Hi there, and thank you so much for having me today. So my name is Jenna Valleriani. So I am a postdoc fellow at the BC Centre of Substance Use, but I'm going to be wearing my Canadian Students for Sensible Drug Policy hat today. I'm a strategic advisor with them, and I have been working with them for about 7 years now. Okay, so the declaration, so I have written for cannabis publications for pay, and I have spoken at cannabis events for travel only. I wanted to also talk about CSSDP. So at one of our local chapters events where we held a cannabis on campus event, lunch was provided by industry. And the work that I'm going to be speaking about today comes from an unrestricted grant to Canadian Students for Sensible Drug Policy from Canopy Growth. But in terms of mitigating bias, it was an unrestricted grant in the sense that we had complete autonomy over the research team, the actual research, the messaging, the content, the design. And additionally, we had it reviewed by a youth content team who was external to Canadian Students for Sensible Drug Policy. And we had 9 external reviewers, experts in various areas of the field, review it independently and provide comments to ensure a fair and balanced assessment of the evidence. So today what I'm going to do is discuss how access to evidence-based cannabis education is really critical to young people's health and their decision-making and well-being. I'll consider how we can use legalization as an opportunity to offer pragmatic youth education, education that's inclusive of both prevention and harm reduction, really to maximize effectiveness and protect all young people, and talk a bit about what a youth-centered approach to cannabis education looks like and why these kinds of approaches really need to be prioritized moving forward. And also consider how we can apply these kinds of ideas and information to other contexts when we're talking to youth about cannabis. So, according to the Canadian Cannabis Survey in 2017, which is one of the surveys we heard about yesterday, past 12-month use was reported as high as 41% for adolescents who were 16 to 19 years old, and 45% for young adults aged 20 to 24. So I want to point out that this sample is a lot smaller than kind of the bigger surveys that we typically draw from. So usually that number actually sits at about 25%. But regardless, it was meant to make a kind of a broader point that the illegal status of cannabis has never stopped young people from using it. And just kind of noting that moving forward, for a lot of youth, nothing is going to change if they're under the age of 18 or 19 years old. So what really can change is the kind of educational supports that we're able to actually offer them in a legalized context. Another thing to kind of note is that a majority of young people who are using cannabis infrequently. They're not heavy users, and as such, they don't experience significant harms from their use. But in any event, regardless of these relatively high rates among youth, we need educational approaches within a legalized context that serve youth who don't use cannabis, but also considers young people who are using cannabis. So I think a lot of the times this can be really difficult because the term youth actually encompasses a really diverse set of young people. And unfortunately, there's no kind of silver bullet approach that I can offer you to talk to youth about cannabis. In terms of educational and prevention efforts, we know a lot about what doesn't work, but we're not really clear on the things that do work. So before I talk about what CSSDP has been doing, for folks who may not be familiar with our organization, we're a national nonprofit organization consisting of young people and students who engage with drug policy issues locally, nationally, and internationally. So kind of our first foray into what was happening around the legalization debate, what really caught our ear here was this discourse around protecting youth, and that being one of the central mandates to legalization. So in September 2016, we held a roundtable attended by about 30 kind of diverse young people in Toronto, Ontario. We had a member of the task force there. We had someone from the Federal Legalization Secretariat there as well. And at this roundtable, one of the things that kept coming up over and over again was that young people wanted access to education that was going to prioritize the development of the knowledge and the skills that they needed to make informed choices around cannabis use. So what we were hearing a lot of was that young people were accessing a lot of this information online and that there were so many competing resources that it was really hard to make an assessment of what the actual harms and risks were in relation to cannabis. When they spoke to us about drug education, a lot of the things that they spoke about was that Most of the education they had been subjected to was rooted in abstinence or stigma-based programming. A lot of young people told us that they don't remember anything cannabis specific about the education they were receiving, so kind of pushing it into a broader category of, all illicit drugs. That there was an exaggeration of risks, there was no discussion of potential benefits, so they spoke about how they knew there was a medical system in Canada, but that nobody was telling them about it. And a lot of the times the education they were receiving was just really disconnected from the way young people were experiencing the use and the use around them on the ground. Another thing they spoke about was that it ignored the spectrum of use, so that when we're talking to young people, we often are talking to them about abstinence or we're talking to them about problematic use, and we're kind of ignoring all of the stuff that kind of comes in the middle. And of course, lacking harm reduction was a really big one that kept coming up. Issues around delivery. So I have the DARE photo there, and Dr. Saw had it as well yesterday. But the idea that, when I was young, I remember a police officer coming into our schools and giving us that drug education. So, questions around who should be delivering kind of drug education. And that there were limited sessions or time devoted to curriculums. So how many of those actual classes that focus on drug education are speaking, about cannabis itself? And a really big one was really about how parents are often really left out of this process. So, so youth were telling us that the messaging wasn't consistent in terms of what they're hearing from schools and their homes and their communities among their friends. But also, more critically is how can we expect young people or parents to have these conversations with young people? I mean, even for, myself, when you're digging through the literature, it can be difficult to assess the harms and the risks of cannabis. Also questions around what if they have no experience with cannabis? How do they have those conversations with young people? And what if they're cannabis users themselves? So these conversations become increasingly difficult to navigate. So we've been doing some other engagement events. So we've had these cannabis on campus events meant to kind of unpack what cannabis policies in universities should look like. But what I'm going to talk about today is really our Sensible Cannabis Education Toolkit that was just released on Wednesday. And this was really building off of our work at the Youth Roundtable. And the kit itself is broken into two pieces. So the second section is focused on content that we believe merits inclusion in a comprehensive cannabis education. So things like harm reduction, but also a really detailed literature review of the common health claims associated with cannabis use. So this is all available online in the full report. The first section that I'm going to focus more on today is really about highlighting guiding principles and best practices in cannabis education, and by extension, a lot of these can be applied to simply having conversations about cannabis with youth. So we see this toolkit as a kind of starting point for the development of educational approaches that can allow for flexibility and really provide insight into how we can actually operationalize cannabis education in practice. So here are the kind of 10 guiding principles that emerged from our lit review, and it's kind of a framework of core concepts and principles. So this isn't a ready to go drug education curriculum. It's not a script for a cannabis conversation with young people, but they underscore a broad set of principles that collectively can really guide the design and the implementation of youth cannabis education and really help with approach and style when talking to young people about cannabis. So I also acknowledge that young people are very diverse, so these principles really do need to be adapted and implemented in different ways that will best serve the context. While the following principles are not listed in order of importance, they're certainly mutually reinforcing and they overlap in some instances, but they reflect the current state of the research and the information that has been gathered in our consultations and workshops with our chapters and with our members when thinking about the promotion of health and well-being among young people. So due to time today, I'm just going to focus on 5 of them. And I chose these ones because I think some of these also have adaptability in simply talking to young people as well, and I hope that's going to be more useful for the audience today. So, I mean, this one's really not surprising. It's the idea that young people, first and foremost, really need to be given accessible and evidence-based information about cannabis, rather than abstinence-based approaches, which is centered on the idea that avoiding drug use is the only acceptable option. So these kinds of approaches often rely on stigmatizing people who use drugs. So we know from the research that authoritarian and fear-based approaches to drug education and cannabis conversations can actually alienate young people, and it can really undermine the credibility of educational efforts and having those sensible conversations. It should also be noted that while drug facts are important, they're not enough. So evidence-based education really means also addressing the wider social contexts of youth drug use. So rather than just throwing out the drug facts to youth, which has not been shown to be effective in and of itself, effective cannabis education would actually rely on a combination of elements. So an evidence-based approach means that it's interactive, it's multifaceted, it incorporates other important aspects of personal development, like general decision-making skills, social skills, how to manage stress, and harm reduction. So with most of our principles, the best approach really depends on the context. So thinking about the age of the people you're speaking to, cultural considerations, and the realities of youth experiences are all factors in deciding what is the right approach. So the second is this idea around open dialogue that is non-judgmental, and in education using more interactive approaches that allow for more interactive dialogue. So young people often don't have avenues that allow for open and balanced discussions around cannabis use with adults. At many of our roundtables, a lot of the young people said that this was one of the first times that they've actually been able to talk about their cannabis use openly. In terms of employing interactive approaches in broader educational efforts, the use of innovative resources such as films, which we heard about yesterday, can actually be used as a tool to encourage open and non-judgmental dialogue, decision-making around cannabis use, and this continues to demonstrate promising results. So to address concerns about how to approach cannabis education and these conversations with youth, promoting open dialogue seems to be very important, and ways to do this can include simple things like asking a lot of open-ended questions, thinking about how we can really meet young people where they're at. So it's crucial to be, respectful and be non-assuming about young people's experiences, and really considering that this idea of trying to get young people to be open and honest with us sometimes also takes a little bit of time for us to develop a rapport with young people first. And I mean, what really underscores these conversations is that acknowledging that some young people are going to choose to use cannabis regardless of the resources or the messaging that we provide them or what the legal context is. Therefore, thinking about meeting young people where they're at, it could be a conversation about prevention, but it could be a conversation about the differences between appropriate and problematic use. It could be a conversation about harm reduction, particularly as cannabis moves into a legalized context. The other point is this idea around meaningful inclusion in our educational efforts. So again, youth aren't really given the opportunity to participate in a lot of the key decisions that affect them, and as such, there can be a lack of understanding around what their needs and experiences are with respect to policy and educational design, as well as what implementation looks like. When consulting with youth, being really sure to avoid things like tokenism. So we see that a lot where a young person is kind of included symbolically, but they're not really given any meaningful opportunities to participate. So that often is, not being conscious of things like imbalances of power, and drawing on a lot of negative youth stereotyping, which actually doesn't really resonate with young people. Youth should be engaged as credible partners, and their input should be valued. So involving young people contributes to ensuring drug education and the way we're talking about cannabis to them is actually relevant to their needs, and that it actually reflects their experiences. Aside from the inclusion in the development of drug education tools where they can also provide continual feedback, they can evaluate the resources, youth involvement in educational delivery has also been associated with improved efficacy of drug prevention programs, and this is alongside trained program facilitators, which also have better results in terms of delivery. But in terms of peer-led delivery, which is in addition to interactive learning, young people's participation in educational reforms should be thought of as a social justice issue that's tied to the development and access to what we should be thinking about as crucial health resources. So I wanted to add this one in because I recently have been getting a lot of emails from parents who are panicking about, what to do, what resources are out there and what's available. I would imagine that people in the room who are healthcare providers probably get a lot of questions from parents as well. So I think for some parents and guardians, discussing cannabis use can really be intimidating. Again, this could be lack of knowledge, lack of experience around the effects of cannabis. So thinking about ways that we can support families in initiating these conversations can provide an additional support for youth, but also ensure that we're not just simply leaving parents in the dark, as has often happened with drug education more generally. So support for parents can include a variety of things. So it could be providing accessible resources to parents, schools keeping parents in the loop about what they're learning, parenting groups, community activities, programs that include both parents and kids around cannabis. And it could also just be as simple as being able to direct parents to digestible resources that are already available online. So this is often a really overlooked part of supporting youth in our educational efforts. The other point is the inclusion of harm reduction. I think that we're hearing a lot more talk around this as well. And we know that harm reduction efforts are really rooted in this goal of reducing the risks and harms associated with cannabis use rather than eliminating use entirely. I've heard Dr. Saw say that just say no may work for some youth some of the time. And I think that that's a really good place to start. And it also makes us think about the fact that we're also not always considering youth who are already using cannabis. And we might be doing a disservice to them by not giving them any tools in terms of education. So if we think about other contexts, such as in the context of sexual health education, research has demonstrated the effectiveness of this more comprehensive approach in things like delaying initiation, reducing sexually transmitted diseases, and avoiding unwanted pregnancy. And these programs do not encourage youth to start having sex. So an approach to prevention and education that focuses both on reducing the harms and giving young people the tools to make informed choices is increasingly utilized as a more realistic approach to drug education. In the case of cannabis use among young people, reducing the harms can still promote things like trying to delay the early onset of use, prevention efforts, but this doesn't have to be the sole focus of our educational programs. Generally, we're seeing harm reduction is most effective with older youth, so this is senior high school students and above. It's shown some success with high-risk populations and adolescents who are already using cannabis. They've been effective in reducing high-risk behaviors, such as reducing the occurrences of driving under the influence. And it should be noted that there's also some research around the value of brief intervention programs, which was also touched on yesterday. So these are like brief interventions that are aiming to identify current or potential problems with cannabis use and motivate people to kind of change their more risky behaviors. So through the things I was reading, this could be as straightforward as 5 minutes of brief advice or 15 to 30 minutes of brief counseling. So generally, these are not intended to treat people with serious substance misuse issues, but they can really be a valuable tool for more risky cannabis practices. I threw in this slide here about applications to healthcare providers, noting that there are so many of you in the room today. So I really do acknowledge the challenges in navigating these conversations with young people, but also just to kind of at least consider that over-exaggeration of harms or expressing disappointment when youth are honest, it can really be counterproductive. It can prevent youth from being honest with key adults, including healthcare providers, about their use. Another thing is that although young people may be using cannabis for the more kind of euphoric effects, we're also hearing a lot how youth are using cannabis as a source of kind of self-medication. So they're talking a lot about relieving stress, relieving anxiety, depression, sleep problems, appetite. So, is this an opportunity to kind of unpack why, when and how often they're using cannabis without undermining their experiences, but give the opportunity to discuss their vulnerabilities, to reduce potential harms, and to talk about what problematic use is in this regard. So again, brief interventions could be a really helpful tool here. They can be ongoing and afford healthcare practitioners a chance to discuss cannabis use if it's appropriate. Particularly since a majority of folks in Canada are visiting a healthcare provider at least once a year. The ongoing nature of this relationship means that interventions can be spread out over time and they can be ongoing. And these kinds of discussions can really focus on providing information about cannabis-related risks, advice to maybe change some of those risk behaviors, and talk about the good and the not-so-good things about their current cannabis use patterns. So in this way, there can also be a lot of value in just simply knowing what resources are out there and being able to direct young people and their parents to those resources. So I wanted to highlight a few of the resources that I really like and that CSSDP really likes, and that we use often and we direct people towards. So the first is Cannabis Use in Youth, a Parent's Guide. So it's really kind of a digestible, easily accessible, easy to read kind of resource for parents. But I would encourage you to just actually look at them and decide for yourself which resources that you like the most and that you feel comfortable with. The other is Abstinence Plus. So I've linked it, there's a citation there that links it to an academic article that you can have a look at. But Abstinence Plus focuses on comprehensive education, acknowledges the persistence of cannabis use combined with its changing legal status, and really underscores health and safety. One of my favorite resources is Using Evidence to Talk About Cannabis from the International Center for Science and Drug Policy. So this is like a quick, easy, evidence-based responses to commonly heard claims around cannabis use and regulation and health. Of course, there's Cycles, which we heard about yesterday from the Canadian Institute on Substance Use Research, and that's the film-based resource we heard about that encourages open dialogue around use. Of course, CRISM's lower risk cannabis use guidelines, which we just heard about, but also a really great and accessible resource, particularly the user brochure. And of course, the full report, the Sensible Cannabis Education, a toolkit for educating youth, is available online. There's about 400 references there, so it's quite a hefty document, but there is a lot of really great information in there. So kind of the bottom line here is that legal regulations is really offering us an opportunity for more pragmatic cannabis conversations with young people. And if we keep on reaching to the same approach and repackaging that approach, we're going to likely miss the mark with young people. And that access to evidence-based drug education is critical for youth and for their health. We need to really prioritize the kinds of approaches that include youth voices and experiences. We want to ensure that our educational messages are actually resonating with young people. And drug education should really be inclusive of both prevention and harm reduction in order to maximize effectiveness and protect all youth. So I just want to conclude by saying that young people have a right to honest drug education. This in turn impacts how equipped they are to make choices around their health. So this is going to be how we protect young people, by helping them navigate the changing legal landscape and their experiences with their friends and their families and their acquaintances. Restrictions in and of themselves have never stopped young people from using cannabis or other drugs. So we could also do some more work here in establishing norms around what appropriate adult cannabis use looks like. This could be used as a method of health promotion in the sense that we do it with alcohol. We give out that messaging around drinking responsibly as a way to promote appropriate norms around drinking, and we could also consider what that looks like for cannabis as well. And so references, but I also just want to acknowledge the toolkit co-authors and our reviewers and our youth content team, Hillary Black, and our board of directors and chapter members. Thank you.